The uninsured are us. There's no difference. There's not like there's a population over here, over there. In Pittsburgh, the uninsured are each one of us.
Funded by the Atlantic Philanthropies, the National League of Cities awarded grants and provided technical assistance to 8 cities in the Cities Expanding Health Access for Children and Families initiative between July 2014 and December 2015. The goal of this project was to help cities develop the skills and capacities needed to identify and enroll children and families who are eligible for, but not enrolled in, Medicaid, CHIP, or Marketplace coverage.
You walk down the street and it's very easy to see families, and in many cases they're uninsured. They're my children's friends and they're my neighbors and they're the folks that we work with. And that was, it just was brought home very clearly to me through this project.
We have to step up and do something different. We have to come together as a city and we have to solve this problem differently. So let's roll up our sleeves. Let's think about what we can do collectively that's never been done before.
Cities focus efforts primarily on finding and enrolling uninsured children because all children are eligible for coverage. Despite their eligibility, the problem of eligible but not enrolled children persists nationally. In states in which grantee cities were located, the percentage of Medicaid or CHIP eligible but not enrolled averaged 10.9%. 3 states, Florida, Georgia, and Texas, are above the national average of 11.7%. Reaching children and families was more complicated than city staff expected.
Many times we have an assumption of how something is going to work, and it seems pretty easy. When I came into the planning process, I thought it was a simple ROI. How long does it take to fill out an application? And how many hours of the day do we have? This is how many enrollments we should be able to do. But it actually took a lot of trust. And a lot of the assumptions that we made, we had to abandon and rethink. And it took a lot of tenacity for the team and a lot of trust building. It takes a lot of time to build the trust with the family for them to, give you this information about themselves.
To reach and enroll children and families, city staff used collaborative approaches, targeting outreach to where uninsured residents live, work, and play, and also shared successful methods with their peer cities.
We try to understand how our community moved through the seasons and where it is that they are located. So we work a lot with captive audiences. So if there was an event where there was in a faith-based organization giving turkey baskets in the month of November, we were there doing enrollment. Or if it was Christmas, we know people doesn't go out during the winter. At least in New England, it's very hard to go out in the middle of the snow with your children, but people will go out to pick up their presents for Christmas. So being in the places where your community is, if it is a laundromat on the weekends, understanding where they move and where they are and what are their priorities.
We at the county level, our resources are slim, but we also aren't embedded in the communities in the way that some of these other organizations are. And this is the kind of work that really takes on the ground community organizing and outreach. And so working with those organizations that have those skill sets can really help you get things moving.
So a lot of this information is out there. Obviously, there's no one-size-fits-all cookie-cutter example, but you can definitely take from the lessons and challenges and strengths and opportunities that other cities have encountered and make that your own.
Some cities used out-of-the-box strategies, such as March Pittsburgh, a parade that marches through Pittsburgh's neighborhoods to literally drum up awareness of healthcare enrollment options.
The idea for March Pittsburgh was, how do we have a fun, accessible event for teenagers to get involved with? How do we get them to be involved? And so we wanted to attract teen musicians to be able to play with professional musicians and then walk through the streets so we could drum up that excitement around this campaign.
The whole premise of the marching band idea was to mimic second line parading in New Orleans, where people can actually come out of their houses. That was our magnet, the idea that the kids would come out with an instrument and follow along and play along. So once they came into that parade, we had our local enrollment partners that would talk to their parents about the importance of healthcare and enrolling opportunities.
For cities considering outreach and enrollment work, some takeaway lessons are to assess community needs, expect implementation challenges, and to think creatively about partnerships that can identify uninsured children and families.
We really encourage the cities to take the time and do a community assessment, do community surveys, focus groups, and really get a sense and understanding of what the needs are in the community, who else is in the environment, what else is happening in the environment, and then really trying to figure out where the holes are and what holes need to be plugged.
You may have a plan, but you need to recognize at the very beginning that you're going to make a lot of mistakes. You're going to encounter barriers and challenges you never thought of or never knew about. And you need to figure out as a partnership and as a team how you're going to actually overcome those. And that requires humility as a partner and humility as a partnership.
Think differently about this. Recognize the fact that a health insurance company can't do it alone. A mayor's office can't do it alone. A nonprofit that serves kids, grassroots in the community, can't do it alone. But together, that's a powerful force to bring to the table.
To create healthier cities and give residents a healthier future, staff from participating cities agreed that it is vital to undertake this work.
Every child is important. Every single child is important. So if you have a handful of children compared to your total population that are uninsured, it's tantamountly important to still reach out to them and get them insured, because your children are going to be your future. If you care about your future, you're going to get to those children and make sure they're healthy.
When children are insured, they have better health throughout childhood, greater academic performance, and are less likely to use emergency health care services. Cities have made strides in ensuring that their residents are healthy and productive, supporting 11,240 enrollments and 2,959 renewals from August 2014 through November 2015. Learn more about how to increase access to health coverage for children and families in your city